Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. Well, it's the middle of the summer, and the Congress is hard at work, and I'm so pleased to say that the Senate has finally introduced the Medicare Orthotic and Prosthetic Patient-Centered Care Act. The bill number is S2556, and that matches the House companion legislation, H.R. 1990. So we've got two identical pieces of legislation that impact the orthotic and prosthetic profession in a very significant way in the Congress, in the House, and in the Senate. We're going to be working very hard with our alliance partners, with AOPA, who has taken the lead on this legislation, and we congratulate them and their lobbying team for all the hard work that went into introducing this bill in the Senate and getting real significant bipartisan support. Let me tell you who signed on as original sponsors of this legislation. Number one is Senator Warner, a Democrat from Virginia, and he's joined by Senator Daines, a Republican from Montana. So we've got a relatively senior Democrat on the Finance Committee and a relatively senior Republican on the Finance Committee. That's fantastic news, because the Finance Committee is the committee in the Senate that will eventually mark up and pass this legislation. Our goal is to get this passed by the end of this Congress, hopefully by the end of this year. But if that doesn't work, and if we're not quite there yet, then we certainly have 2022 to get this done and over the finish line in the 117th Congress. They're joined by, Warner and Daines are joined by Senator Duckworth, a champion of orthotic and prosthetic issues. She's a Democrat from Illinois. Senator Cornyn from Texas, a Republican from Texas who has done a fair amount in the healthcare arena and also is very instrumental on the Republican leadership. And Senator Cassidy, a physician, and Senator from Louisiana, a Republican. He is joined on with the bill. And Senator Grassley, who has long supported this legislation from the state of Iowa, also a Republican. So we've got some really good Democrats and some really good Republicans in the Senate to support the bill. And that's really critical, to have bipartisanship in the Senate at a time when the Senate literally is 50-50, 50 Republicans, 50 Democrats. Of course, the Democrats run the show in the Senate, and Chuck Schumer is in charge as the majority leader. And we'll be doing all we can, working with AOPA, the Alliance, all the other stakeholder organizations that support this legislation to try to move it forward. There's a number of steps that need to be accomplished. Step one, the most important thing that we need to do right now, and that you can help with, is conveying to members of Congress who represent you the importance of co-sponsoring this legislation. We ask you to go to the NAAOP website, www.naaop.org, and click on to the Legislative Action Center and send an email, pick up the phone and call your member of Congress and your two Senate offices and express your support and encourage them, ask them explicitly to co-sponsor H.R. 1990 and S2556. This is critical. The way that leadership understands which bills have support and which bills will ultimately begin to move through the committee process, marking up those bills, adding them to larger legislative vehicles that will eventually be brought before the House and Senate for passage. The way that that happens is to demonstrate that you've got widespread support. The way that you demonstrate widespread bipartisan support is to build the number of co-sponsors who join on in support of your legislation. So you can be instrumental in this. We ask you, pick up the phone, 3 phone calls. We ask you, send in these emails, follow up, try to talk with the staff, the health legislative assistant that controls or that manages the congressman or the senator's healthcare portfolio. And do all you can to try to get them to sign on to this bill. I've talked about the contents of this bill and what this bill does before, but let me just reiterate very quickly. It does 4 main things. First thing it does is distinguish between durable medical equipment and the clinical services provided under orthotic and prosthetic care. That will enable CMS, the Centers for Medicare and Medicaid Services, to regulate this profession differently than it regulates durable medical equipment. Now, they currently have differences in how they regulate the two, but they're all out of the same exact statutory language. What we're trying to do is create a separate section of the statute for orthotic and prosthetic care alone. Number two, the bill would redefine and reinstate congressional intent regarding the definition of off-the-shelf orthoses, which would be subject to competitive bidding. This involves a definition known as minimal self-adjustment. Orthotics that are subject to minimal self-adjustment are able to be competitively bid. They're determined to be orthotic, off-the-shelf orthotics. Not all OTS orthotics are currently being competitively bid, but about 22 codes are. We believe there are certain codes that are subject to competitive bidding or may be subject to competitive bidding in the future that involve clinical care that are not, really should not be defined as off-the-shelf orthotics. And we're asking that Congress correct this. In addition, we are saying that all custom orthotic and prosthetic care really does require the services of a clinician. And the clinical services are critical to the safe and effective and therapeutic use of custom orthotic and prosthetic care. And therefore, we're recommending the banning of drop shipping for anything but truly off-the-shelf orthotics. And then finally, we're requesting an exemption for certified and licensed orthotists and prosthetists from competitive bidding. Much like physicians and therapists, certified and or licensed orthotists under this provision would have the ability to provide patients with off-the-shelf orthoses, even if they don't have a contract in their area. And now, of course, they'd have to provide it at the competitive bidding rate. So they would not be providing it at the typical fee schedule amount. So the federal government wouldn't spend any more money with this, but it's a very patient-centric proposal. That's the one thing that this legislation really does have as its focus, patient centricity. And so we ask you to convey these points to your members of Congress and to ask them to join as co-sponsors of the legislation. Again, go to the Action Center, Legislative Action Center at NAAOP.org. We thank you for listening. We thank you for making every effort you can to build widespread support for the Medicare Orthotic and Prosthetic Patient-Centered Care Act. Thank you.